to work together. What a pleasant way to welcome you to another informative and educative edition of the program Roadway to Health, an hour-long program brought to you by the Ministry of Health, of course designed to educate, inform, and empower Liberians about health-related matters. Oh, well, today is Tuesday, the 31st of March 2026, and driving you through this edition of the program, I am Angela Noor and
Melvin Stewart.
So however way you are joining us this morning, wherever you are joining us from, we'd like to say welcome. It's always good to be here with you. For those of you joining through the ministry's official Facebook page, I'd like to encourage you, as always, to like and share the live. Invite a friend to watch along with you. And to our dedicated radio listeners, it's always good to be here with you. Stay with us as we have a beautiful, beautiful package for you this morning. Well, this morning we are set to bring you education, awareness in every way possible on eye health and vision this morning. But before we, talk more on this topic this morning, bring you the voices of our guests, the names and everything, we will firstly follow the tradition of our program by bringing you development updates from the Ministry of Health, telling you what's happening within the health sector, especially for our radio listeners, those of you who don't have access to smartphones. We're doing all we can to make sure that you get access to information. And for those of you who have access to smartphone, we'll just be bringing you a couple of what's happening within the health sector, so you can also visit the ministry's official Facebook page and read more development updates. So we join Melvin Stewart this morning to bring us development updates. Good morning, Melvin.
Good morning, Angeline, and good morning, everyone.
Okay.
It's another good day to be part of this program, Roadway to Health, and a very good program that is always helping to sensitize our citizens across the country and the world beyond on the workings of the health ministry. Well, like you said, it's a normal tradition here on this program. We are on the official website or the Facebook page of the Ministry of Health of the Republic of Liberia. And on March 30, the Nimba County Health Team received 28 brand new motorbikes from the Ministry of Health and partners to strengthen health service delivery across the county. And at the handover ceremony in Sanikoli, Nimba County Health Officer Dr. Puni Robert Lee Dulu thanked Honorable Minister of Health Dr. Louise M. Butu and her team for the support and urged staff to use the bikes solely for their intended purpose, bringing quality health care closer to the people of Nimba County. You see the photographs of individuals from the Ministry of Health and the motorcycles presented to the health workers here as well. Also on the 30th, the Ministry of Health began the construction of the Monserrado County Health Team headquarters in Bensonville. I think the last time we hosted the county health officer here. She spoke about that project. Now the project has reached to this level. And this new facility will actually provide a dedicated space for the hard-working county health team, staff, thereby strengthening coordination and improving healthcare services for the country. And again, a lot of things happened just in the course of the winding down of this month. On the 29th of this month, the Ministry of Health, in partnership with the Ministry of National Defense, commenced the construction of modern dormitory for nurses, doctors, and health workers at the St. J. Comprehensive Health Center in Grand Kitmount County, that's in Western Liberia. And the project aims to address the long-standing accommodation challenges faced by health workers assigned to the facility, while also encouraging more professionals to serve in rural communities, because in the past, Many healthcare providers felt that it was not prudent enough for them to serve in those communities in the rural parts of Liberia because of the lack of accommodation for them. But now the Minister of Health and her team has started wisely that this is something that they need to work on. And the project underscores the government's commitment to strengthening the health system and improving working conditions for frontline health workers across the country. Yeah, so basically, the Deputy Director of Family Health Division, Tameke Yeke Sa, represented the Ministry of Health at the International Maternal and Newborn Health Conference 2026 in New York. That's in Nairobi, Kenya. And the second edition of that program, of that conference, convened by Alan MNH in partnership with MOH Kenya and in collaboration with many NGOs, brought together 40 officials, country delegations under the theme moving forward together. Yeah. So, Angel, basically, these are some of the developments. The Ministry of Health and a lot has still been done under the watch of the minister and all of our deputies, technicians, and all other persons that are working at the Ministry of Health. So it's always good that we update the public about these happenings.
Thank you very much, Melvin. And that's it for our development updates from the ministry's official Facebook page. To get more on what's happening within the health sector, you can always visit the Ministry of Health official Facebook page to know what's happening. On a regular basis, development updates are being posted, and you can do yourself a favor by visiting the page to know what's happening within the health sector. So as I stated previously, this morning we are set to talk more on eye health and vision, importance of caring for the eyes. I'm so excited about this topic this morning, Melvin, because the eyes are important parts of the body, and without the eyes, I believe that our guests are here and they will tell us more, but without the eyes, I strongly believe that effective living is not going to happen. It's important that we take care of our eyes, but how do we properly take care of the eyes, and what are some of the things we are doing that are affecting the way we are taking care of the eyes or one way or the other? So this morning we'll be talking about eye health, and we have our guests from JFK, specifically the Liberia Eye Center. We have a consultant optometrist and also a clinical tutor, and then we also have doctor of optometry, and then we also have optician this morning. But I will allow our guests to introduce themselves this morning, beginning with the very first person. So good morning.
Yeah, good morning.
How are you doing? Welcome.
I'm fine. How are you?
I'm fine. Can you begin by introducing yourself?
Yeah. So, hello everyone. I am Amrit Jha, and I am from LV Prasad Eye Institute. LV Prasad Eye Institute, LEC.
Is that okay? Okay.
So, from LEC, JFK, and I am optometrist and clinical tutor also. So, yeah, this is my brief introduction.
Okay, thank you. Welcome.
Thank you.
How are you doing today?
I'm good, thank you.
Let's say you can put it in my closer. Are you okay, right? Okay.
Okay. Am
Let's
I
hear
good?
you.
Okay, so thank you. My name is Alfred T. Bunda. I work with Liberia Eye Center, LV Prasad Eye Institute. I'm an optician. Yes.
Okay, let's hear you. Good morning.
Good morning.
Welcome again.
Thank you very much.
Okay.
Yeah, I am Dr. Douglas George K. Levy, an optometrist and a community eye health specialist. I work with Liberia Eye Center, JFK. Thank you.
Okay. Let's begin with you on Dr. Douglas, right?
Yes.
Okay. Dr. Douglas, Doctor of Optometry. can you tell us a little bit of the optometry? What does that mean?
All
I
right.
mean, what do you do for the eyes?
Okay. The word optometrist is a very new word, as long as Nigeria is concerned. When we talk about optometry, we are talking about the primary eye care service. When we talk about primary eye care service, we're talking about reaching out to people from the grassroots before coming to the tertiary institution, for them to know about their eye health and what they're supposed to do in terms of taking care of their eyes and how to manage before the complicated ones could come to the tertiary institution. For example, we talk about identify preventable eye conditions,
Okay.
refractive errors, and eye conditions that could not need surgical intervention. So when we engage them from the primary route, I think before it reaches to tertiary case, it would have been managed.
Okay.
So that is all about optometry.
Okay, optician.
Yes.
Okay, what does that mean also?
So, in the eye care setting, when you hear the word optician, it means someone who deal with glasses.
Okay.
So to put it in a simple labyrint way, somebody who can face glasses. So at the eye center, so the optometrist, like Dr. John, he will see the patient and then prescribe glasses. And then the patient will come to, they will say, go to optical department. Simply, they are telling you, go to glasses area. So you come to the optical, and then we will start from there, tell you what kind of glasses you need,
Okay.
how the glasses should be fixed, how you should use it. So that is actually the work of the optician in the eye, clinic.
Okay, optometrist. It sounds more like the optometry. So what's the difference, optometrist?
So
What do you do as well?
Yeah. So very nice question. So thank you for that. Optometry understands for the study, like how we know about the biology, geology. So optometry is the study about the light and eye combined, all optics and about the eye, how the people see. Whereas the optometrists are the practitioners who deals all of these optics and eye related diseases, glasses, and all in a broad spectrum. So optometry are the education, whereas the optometrists are the professionals.
Okay, so because you are optometrist,
Yes.
I think we should just kick off the conversation with you.
Okay.
Before we deepen our discussion when it comes to localizing eyes and how people behave around it, I think we should give our listeners a little bit of biological explanation in a clear and concise way to give it an idea of why it is very important to take care of the eyes. I mean, what are the eyes, the different parts, and how each of them support vision?
So yeah, if you see eye is the only one organ in our body which is totally exposed outside to the world, right? If you see, all of our parts in the eye are covered, but the eye is the only part which is exposed to the outside world, and even it is connected with the brain itself. So it is also considered as the part of a brain. So when you don't care the eye, the maximum 80% of your all surrounding knowledges you get from the eye. Once you get a blind or visually impaired, 80% of your surrounding information you will get cut off through that. So it is very much important to get knowledge about eye, its care, and how you can manage in a very good way.
Okay. Dr. Mr. Bondo, you want to add a word?
Yes. So thank you. The eye, from the optical perspective, so is the light of the body, like you said. So if you are, going blind because of glasses, that is something that shouldn't happen. So for us, the word, like he said, optic, it means the light. So we give light. So you can see, people coming because of a refractive error, meaning they can see clearly, and it reduce their activities, it reduce, their productivity. But once they come and then they get a correct glasses, they are good. Their vision is back.
Okay.
Yes. So it's always good, to check your eye, know whether you need glasses that will improve your vision and get the correct glasses. I'm emphasizing on correct glasses because we don't just, you don't just grab glasses and use it from anywhere.
We'll definitely get that. We'll definitely get to that part. Okay. Dr. Douglas, Melvin, Dr. Douglas, the eyes have so many parts.
Yeah.
Yes. I want to know if the eyes function well in the absence of one of the parts, or they function together in the absence of one. Anything happen to the vision?
All right. Thank you very much for that question. Many times people do not understand the question you ask, because I think through this platform, people got to understand. The eye looks small, but it's a very big organ, and it doesn't work independently. Let's start from the outer part of the eye, you call the eyelid. Without the eyelid protecting the eye to reduce exposure to dust and everything, your eye will have problem. Coming on the side of cornea, if you have a scar or opacity of the cornea, the eye cannot function well. Going through the anterior chamber to reach to where the crystalline lens is found, if the lens have a problem, the person cannot see. You see how all these correlate and relate one to one another. So every part of the eye till it reaches to the retina up to the brain, they have a kind of flow of transmission. Where there is a breakage in that transmission, the eye can no longer function. So every part of the eye have to work together for you to have a clear vision.
So for an example, if the cornea, as you stated, has problem, it affects vision generally.
Of course.
Okay, Melvin.
So then let us understand. You spoke of disease and or diseases that affect the eyes. What are the common diseases that normally affect the eyes?
Okay. Let me start with the most common one everybody could relate to. We call them uncorrected refractive error. Now, what we mean by uncorrected refractive error are conditions whereby you needed glasses to help you see well, but you're not using glasses. Maybe because of some mythical beliefs. Okay? Another one, cataracts. Now, this is a situation whereby the lens in the eye is being clouded, maybe because of aging process. Another one could be maybe because of trauma, someone without accident. In the process of that, the lens of the eye will no longer look clear how it's supposed to be. The characteristic name crystalline, with the lens will lose it. It will no longer be crystal. So you will see the vision become cloudy. In Liberia, we use the word dew. You say having dew in my eye. It's because the lens is no longer crystal clear. We have a condition like glaucoma. Now, this glaucoma, the commonest word a layman in Liberia will understand is pressure in the eye. Now, because of the pressure in the eye, the optic nerves are damaged. In that area, vision is a kind of tampered, and the vision will not be there. So, which means many, even congenital conditions, for example, a child could be born with cataracts. And if it is not detected because the parent would not go to eye clinic for early detection, it also affects that and many more causes.
So then, why people normally do the test? Why is the test important? Because if I'm a person and I'm not experiencing any kind of malfunction on my eyes, and why should I go for test? I see my eyes, I can see clearly, it's not itching, nothing, I don't just experience anything negative. Why should I go for test?
Okay, it's a very important step to take. You may assume you are seeing clearly, but you don't know you are seeing clearly until otherwise proven in the clinic. sometimes, let me use children of school age. A child in the school, we assume the way he's seeing is the correct way or how every other child is seeing until test is being conducted. Let me cite an instance that happened in the course of our school eye health in Magibi County, Kakata precisely. There's this grade 11 student. All his lifetime, he has assumed that the way he sees is the correct way everybody sees. But in the course of the school eye health program, a pair of glasses was given. You will see how this guy shouted, "I can see."
Wow.
Because he couldn't believe that. He had already accepted his fate that that is how everybody sees. And if he is not in the first 3 rows or in the classroom, he cannot see what the teacher writes. But with the glasses, he could even sit at the back chair and he could see clearly. So you now see that there are some conditions that seems latent. You wouldn't know unless you go and have your eye tested. Again, when someone advances up to 45, 50 years, there are some systemic challenges coming in. For example, somebody may be having high blood pressure. Somebody may be having diabetes. Somebody may be having a high level of cholesterol in the blood. Now, when such is coming, it doesn't give some signs. Even glaucoma, it doesn't give signs. But when you get your eye tested, in the process of that, the doctor can have what we call ocular manifestation of those things.
What is that? It's a big
For
word.
example, ocular manifestation simply means that in the course of your eye examination, there are some signs the doctor will see through the eye and able to tell you, go and do so and so test, because we're having a sign of diabetes. We can see a sign of high blood pressure. We can see a sign of some certain tumor. And the person involved wouldn't know such is going on until the eye is get tested. That is the reason.
You want to...
Yeah, Dr. Ja, there are some eye conditions that can be prevented.
Yes, possible.
But at the end of the day, people still come down with it. Can you tell us the causes? What causes that?
So yeah, already Dr. John has told, there are a lot of diseases which are preventable. So the very common in worldwide, if you see, almost 2.2 billion people globally are suffering from the refractive error. So in a simple word, if you ask what is refractive error, it is just need of glasses. Okay, so 2.2 billion people are globally having problem of preventable blindness, out of which 50% of people just need the glasses. So what is the cause? Like how he told, the anatomical parts like cornea and lens. So these are the major things which help us to see. But if any changes happens in those things which are not a permanent changes, which is temporary changes, the optics get altered. So in that case, when you just give the glasses, it will get cured. So this is the refractive error, and it is simply treatable by just glasses. The second one, what we can say, is a cataract. The cataract is the thing in which the lens get dew. Dew means the lens is crystal clear, but with the time, exposure to the sunlight and with the age sometime, these all things get changed in the crystalline lens and it gets a hazy. If you see, if you boil an egg, when the egg is very clear, but when you heat it up, it turns into white, right? So in the eye also, if you see through the pupil, it looks very black, but with the time, in the older peoples, you will see it turns into a little bit white. That is the cataract. So when you do an operation for that, your cataract will get treated and person will see. Lot of people in Liberia, what we have seen, haven't done the proper eye checkup in their lifetime. When they reach to 60 years, 70 years, they come to clinic and they feel they will never see again, but just after doing surgery, they are seeing well. The third one, what I will say you, is the pterygium. The flesh grows in the eye, the black part what you are seeing in your eye, beside it nasally, some flesh will grow. Many people think it is the normal thing which is coming with the age. But if you don't treat it on a time, it will slowly cover your black part of the eye and you will not see that much clear even after operation. So operation is very much crucial in that stage, earliest stage, so that you can see. So I have just summarized 3. There are a lot many more.
So one understanding, because I'm concerned as to whether people get blind or they come down with these vision problems because that can be prevented, because probably they are doing certain things.
Yes.
And what I'm understanding from what you just explained is, I think early detection.
Yes, early detection.
Early detection, people going to know what the problem is, but people are not going at the end of the day. They end up getting visual.
Yeah. So they are not coming because they are practicing something which is coming from the past history. Like many people do the traditional treatments, like they put some herbs in their eye. They believe some milk. If a small baby gets some eye problem, they just put a milk in the eye, and it gets a ulcer in the eye, which spoil the eye completely, and baby gets blind if not treated at a time. So such type of malpractices, the traditional beliefs, sometimes it alters the early treatment of the kid. If you talk in this Liberia population, I think it has crossed more than 5.7 millions, out of which the 40% of population is for the kids. Above 50% of population is for adults, well-grown adults who are working. Only 3% are of the elderly, more than 65 years. So very soon in future, those all who are in the adult age group will turn into old population. If those adult populations are not well concerned about the treatment, awareness, and the scientific managements, very soon most of the population in Liberia will be under the preventable blindness, and there will be more hurdles, more optometrists, more ophthalmologists, more eye hospitals will be required. So if we don't do today, tomorrow will be more trouble.
So let me ask Mr. Bondo. Many times we see, especially children, we see some of the kids, their eyes have different colors, brownish, that smoke kind of color, and their eyes itchy. They itchy 24/7 around the clock. What are the reasons of those kinds of conditions?
Yes, thank you so much. So, Dr. John said, so those are some signs. So for every sickness or eye disease, before it finally manifests, before it gives you, it get to a stage for treatment, it will start with a sign. So if you see your child or children, having too much itching, take them to the hospital. It might be a sign. If you see your eye, eye getting, brownish, like in Liberia, we call it chicken soup eye. Mm-hmm. So those chicken soup eye are giving you a sign that something is happening, with your child's eye. So you need to take them to hospital.
Even if they were born with it?
Yes. So he talked about congenital, condition. There are conditions that people can be born with. Yes. So some of those conditions can be taken care of if it's detected early. Yes. So in fact, that's even the most time to take them to hospital when somebody is born and they come with abnormality. Something that look different from them, so you take them to hospital. It can detect, some early congenital problem that can be taken care of.
Yeah, continuation to that, what you have asked, like the baby gets, but it is not just the baby gets. Sometime when the mother is pregnant, they get some bacterial infections and all within their body. So those infections can affect the kid also, even when the baby is inside. So the baby born with that problem. So not just the baby thing, the mother should be also well taken care. Otherwise the baby will get infection.
Yes, I want to add up to what my colleague just said. When we talk about some of the changing color of the eye and every other thing, sometimes it could be environmental. The environment we find ourselves, polluted air, all those smokes entering the eye could irritate the eye. And again, sometimes when a child having some of those signs, it needs an intervention by the parents. Not to say the child wanted a special care, but you don't know why that child is rubbing the eye too much.
Yeah.
So once we take them to the clinic, it could be that the child having earlier sign of refractive error, maybe astigmatism, or maybe because of the environmental factor, based on how place the child is exposed to dust and everything. Then the eye doctor or the health practitioner there could able to counsel the parents. Please avoid or make the child to be free from dusty environments because the child is reacting to dust. We call them allergies. So in such case, you could see something like that. Because the more the child rub the eye will be changing the color.
Then on the issue of rubbing the eyes, I will bring up traditional aspect to that, where you have the watery eyes. You see water running from the eyes, and the eyes are red, especially so in our certain when the eyes when the eyes are red, we say is something we call Apollo. And people use the salt water to clean the eyes. Is that something we should be practicing? Or if you have Apollo, shouldn't you go to the hospital? Or you should stay home and treat yourself?
Based on that question, the first answer I would say that practice of using salt should not be encouraged. It has caused more harm than cure, people may think, because the toxicity of that combination they put in could give them corneal scar, which would damage that eye entirely. So you imagine a cornea that is not as thick as your skin. You are putting salt on top of it. Imagine you have a sore on your skin, how painful you will feel when you add salt on it. Now, bringing it to the eye. So it causes a lot of problem. So we don't encourage that. The best option would be take to the hospital, let the professionals review the case and give you the best treatment plan to follow.
Okay, Dr. Bondo, you are optician. When Dr. Douglas was talking, he mentioned environment having impact on the vision, like the dust and other things. There were using of glasses come in. Akami, using of glasses come in. So let's talk about this. Sometimes people use any glasses. There are so many practices associated with the use of glasses. Some people just go in there, buy glasses from the market and just test it on their eyes and they go in with it. And sometimes people don't use it at all. So let's talk about the importance of using glasses, and especially prescribed glasses.
Yeah, so thank you so much. What I want to say here is let's normalize the use of glasses. So glasses should be used, when needed or by prescriptions. Let people don't just use glasses because they want to use glasses. Glasses in most part of the world, when you go, before you put on a piece of glasses on your face, it should be recommended. Even if it doesn't have a lens, it should be recommended or it should be prescribed, because the glasses, they are helpful. At the same time, they can also be harmful if you use the wrong one, right? Mm-hmm. So we encouraging people to do their eye tests, and once you have refractive error, use glasses. Even if you don't have refractive error, maybe that you need glasses with a lens or a power, you can also use a plain glasses depending on the doctor's recommendation. Like in Liberia, during dry season like this, there are a lot of dust. People, go through, and like you were talking about environment. So sometimes people require protective glasses. So, but the protective glasses should also be recommended, and you should know how to use it, because if you don't use it the right way, it will also, affect you. So let people practice how to use prescribed glasses or glasses should be recommended. Even the sunglasses, we should know when which type of sunglasses we should use, because we have sunglasses that have UV protection. The purpose of using sunglasses is for protection, to protect you from the UV rays, from the sun rays, and also from the dust. So if you are using the correct one, you have the effect of it. So let people, visit the hospital and get a prescription and use glasses.
Okay, Dr. Douglas, you want to add to?
Yeah, just like my colleague Mr. Tamba just said, Pondo said, coming to the use of glasses, we always advocate for patients to make use of prescribed glasses. Going to buy anyhow glasses, you are at the verge of making a costly mistake. For example, you go on the street to buy already fixed glasses without knowing that the power of your two eyes are not the same. You have the tendency to suffer what we call eye strain, severe headache at times, and even give you some distortion in your vision because the eye was not tested and your prescription was not given. You just go and test, can I see? Yes, I can see. You put it on your eye and start going. And sometimes people make a costly assumption. If Mr. XZY has this kind of glasses and I see, you look here, I'll have to go for my own. But he wouldn't know the reason why such was recommended. For example, someone who works in a bank that always makes use of computer may go to an eye clinic. What the doctor will consider is his profession and give what we call photochromic lenses so that it could reduce the rays of light from the computer affecting the eye. Now, when such a person comes, or maybe with the recent development, we call them blue lenses. Now, when you see that, another person will say, oh, I like this kind of lens. You want to go and buy, but you wouldn't know the reason why the doctor prescribed. So in the nutshell, we encourage that any kind of glass one should go for, let it be a prescribed glass. And again, the frames should be well fitted. If the lenses are not well fitted, it causes another problem. So those are the reasons we encourage get your glasses in a clinic, because they have to take measurements of all those things for the lenses to be well fitted.
Okay, we're about to open the phone lines, but before we do that, let's talk about, because someone listening might be moved and wants to go and do checkup, because we are also, preaching early detection, because that's the only way you can, protect your vision properly, because there's a problem, you can take care of it, very soon. So if somebody wants to go to the hospital, where can they go to see the eye treatment, and what to look out for to say, okay, you need to go now. Okay, I'm experiencing this thing. I think it's about time. Some of the common things that they should look out for and where to go when they start experiencing these things. And right after that, we can open the phone lines.
Yes, so let me start on that. So eye checkup, like any other health issue, should be routine. We don't have to wait some time before the problem arises, before we start rushing to the hospital. So there is this a routine. Even those who can visit the hospital, the Liberia Eye Center, they know we can always tell them, whether you have any problem or not, make sure you check your eye at least one time in a year. If possible, you can even do it 2 times, like every 6 months. But at least one time in a year you should check. So that whether you have a sign or symptom, whether you're feeling anything, do it. Go and check your eye. Don't wait until you start seeing something coming first before you want to go to the hospital to check your eye, right? Because if you do, the early checkup the routine checkup will detect something coming up, and you will get rid of it soon.
Okay, so early detection is very, very important. Don't wait until you start to experience symptoms before running to the hospital. At least once a year is very important to take care of the eyes. So our eyes play a very major role in how we live and interact with the world, and it's only important that we take care of our eyes. So if you just join us, you are listening to Roadway to Health, an hour-long program brought to you by the Ministry of Health, and we in talks with this morning with our health experts from the Liberia Eye Center at JFK, talking eye health this morning. To be a part of this discussion, you can call us on 0775 978 530, 0775 978 530, or 0886 324 740, 0886 324 740 are the numbers to call. Call us this morning and be a part of this discussion. We are talking our health this morning. So let's take our friend. Good morning.
Here is an April Cooper. Thank you, people, for the information. I want to appreciate the doctors that came on the air to at least acknowledge all with these problems. But I want to ask a question. Brother, it's 1 year, that's January, her 1 year, but then she had a itchy eyes, her eyes sometimes dim, sometimes she itch her eye. So in that case, she need a checkup, and what can I do?
Okay.
Thank you.
Okay, 0775 978 530, 0886 324 740 are the numbers to call.
Good morning.
Morning.
Yeah, how are you? This is Uno Kamara, and I'm calling you from Maryland, specifically PO Centers in 4C.
Please be audible, yeah? Be loud now.
I say I'm Bono Kamara. I'm calling from Maryland, specifically Zone 4C, PO.
Go ahead.
Okay, thank you for the program. But my concern is to determine the glasses to be used at a particular moment. How do we go about doing that? And my second question is, there are too much sellers of glasses in the street who don't have no medical idea on how to determine which type of glasses is needed for that person's condition at that time. So how are your department going about reducing such a seller in the street to avoid harming our citizens? Thank you very much.
Thank you. Good question. Morning.
Hello?
Morning.
I'm J. Alexander Tama calling from Lukintown.
Of course, sir. Go ahead, sir.
Yeah, I want to say how solved to my brother in that studio, Andrew or Bundo, Mr. Bundo. Let me, I went for check out those car and I can do the spinning around. I did the spinning around the prescribed eyeglass for me, whether it is necessary. That's my question. Thank you.
Morning.
Yeah, good morning.
Please go ahead.
Well, my problem is, I can...
What is your name, please? What is your name and where you call from?
Oh, I'm Mr. Anthony Flambo, and I'm calling from AB Tobolo.
All right.
Yeah, what I'm trying to say is, if it's standing nearby, I can see from distance. It can't be too clear.
All right. Thank you.
Yeah.
Thank you. We'll take more calls, maybe 5 more persons.
Can you read the numbers?
Yeah.
0775 978 530, 0886 324 740 are the numbers to call.
Morning.
Hello?
Morning.
Good morning. Yeah, I'm here. I'm so thankful for this program. Very educative, but I always go over there. I have my son with the rare eye problem. But I find it so difficult. Where we live is far from the clinic there in JFK. So we leave around 5:30 when we get there, sometimes some minutes to 6 or after 6, the procedure, we get on a line and people will come when the services begin. They will take people from among us and carry them in there. So now we leave from there after 6 without even meeting a doctor. It gets so frustrating. So I'm kind of asking you people to please work on the procedure in getting the treatment there. The system is not like before. Before, whatever time you get there, gradually you get to the doctor. But nowadays, you will sit and 5 person, 6 person behind you will complete before you who came 6, 7 get meeting the doctor. It gets so frustrating. So I want you to please help us so that we'll be effective in carrying our children there.
Thank you. We can take 2 more persons and go back to the guest to respond quickly and give us their party comments as we go on. Morning.
Hello?
Morning. Please leave from near the radio.
I'm Nixon, so my calling from GW Junction.
Go ahead, quickly.
Yeah, I got my daughter. She's about 4 years now. But her eyes sometimes get brown and she scratches, on the eyes, she says, Daddy, you see me. And the eye will just turn brown.
Okay. Thank you. I think if we give the last the last caller, the chance, if you can call quickly, then we leave the platform with the guest. Okay, this last person. Morning.
Hello?
Morning.
Yeah, good morning, sir.
Go ahead.
Yeah, I am Reverend James Lavla, calling from Nidongwe. I have a son. He itch his eyes. And when you refer, you do for like 2 or 3 minutes, just itching his eyes. Where could I get to? Where is the clinic that we think I can find to actually bring him there?
Thank you. Okay, we stop right there and go back to the guest. To just respond quickly.
You heard the callers, right?
Yes.
Okay. So let's begin with you.
Okay.
Dr. J.
Yeah.
Is that it?
Yeah.
Okay.
So most of the calls what I have seen, like 3 to 4 complaints were regarding the brown eye itching. So the most common thing, and mostly that were for the kids, right? So as already Dr. John discussed, so most of the kids at this age, they play outside their home, and that is good thing. The kids should play outside, not in the home. But while playing also, they touch different things which are dirty, right? They play in a sand, they play with the stone, woods and the grasses. So when you touch those things and then suddenly you touch your eye also, that can create an allergy to the eyes at the different layers of the eye, different parts of the eye. So in that case is what you can do. Whenever your kids are playing, returning to home, ask them to wash their hand very nicely, very carefully with the soap and water. And when even they are going to school, ask them to sanitize their hand very frequent. So this is the precautions, but not all kids will follow the same thing. So if they get allergy at final, as soon as possible you are seeing, most of thing what you have seen is they just go to any local shop, they buy gentamicin, they use it, the eye gets more severe, then they come to our eye clinic.
Gentamicin.
Yeah, they go and buy, which is not a good choice.
Okay.
The thing what they have to do is they have to come to the hospital, eye clinic. They have to come to the eye clinic. We will examine which type of problem is there. The allergy can be of different types. So according to that we treat, we give medicine. If glasses are required, we give glasses. If medicines are required, we give medicine. Then it can be resolved as soon as possible.
Okay.
So Dr. Jack will just give us his party comment, then we'll go across quickly because time is out.
So we don't have much time, so you can give us your parting comment from this angle and then we'll go across. It'll be the same thing, your parting comment. Yes, your final message to the listeners before.
Okay, so the final message to the listeners from my side is awareness is so much important with the early treatment. So don't go anywhere else to the local shops or to the eye medicine you don't buy directly from any other shop without prescription, because the treatment is as per the diagnosis what we check. It can look similar, but it will be different. So don't go with the normal stores and these all things, come to hospital and have better treatment.
Okay,
Thank you.
Mr. Bondo.
Yes, thank you. So just to add up a few words to was the allergic, because most of the callers, like he said, were around the allergic and eye itching. I would also like parents, to also observe what they use at home. Nowadays, we have so many, things like spray, some chemicals, so many chemicals, especially women, they use, even the one, we rub on our face.
Our mascara.
Yes.
The different things.
So if you have children, you should also be observant. Why are you using those things? What the children reacting? What is their action? Are they, coming down with too much itching? And maybe try to reduce it and also observe. It could also reduce that itching, and then you will take note that, oh, maybe because I'm using too much spray in the house here, mosquito spray, mosquito coil, all those things children can react to it.
Okay.
It can cause the itching, itching. Yes, so we also have to observe those things. So then quickly to just some of the concerns.
Chief, we don't have time.
Okay. So to a parting comment, I want to take this time to encourage, everybody visit the eye clinic. Somebody asked about where the eye clinic is located. The Ladura Eye Center, we are located in JFK, inside JFK compound. We are there, so just take your time and come to the eye clinic, check your eye, get your glasses prescription, visit the optical. We are there, we will serve you, we will give you the best of glasses that you need, that will help you. We give glasses according to your occupation.
All right.
That will suit you, that will help you, that will not cause any problem for you. So come to the eye clinic and check your eye. So thank you so much.
Thank you. So,
Dr. Douglas.
quickly, sir.
Thank you. I'll just give you one answer to one of the questions. Then I give my departing message. Someone asked about administration in terms of managing long stay in the clinic.
Yes,
I want to touch that briefly. Then I give my departing comment. In the clinic, we have a procedure. There are 4 categories we have: category A, B, C, and D. Now, you may be on the line. Someone in category D will come and that person will be attended because that person is on the VIP category. It could happen. Another one could be someone who had a surgical intervention the other day. When the person comes the next day, it's a priority. The doctor has to see that person, irrespective you are the number 1 to be checked in. And again, each room has different kind of people they are attending. So you may not necessarily understand until such could be explained. Now, on my departing statement, I want to say, let us not engage on costly assumption. My brother have this condition and using this kind of eye drop I will use. It could be deadly. It is better we go and have our eye tested. And doctor could tell you what is the problem with the eye and what is the best treatment plan for you. Thank you.
Thank you. So, Angel, just close up.
Okay, so early detection, like I'm saying, early detection is very important. GFK, the Labrador Eye Center is open Monday to Saturday. So you can always make your way there and check your eyes to know what might be happening or whatever you are observing right now happening to your child. Make sure and go to the eye center. Early detection is important. It helps, save you from future blindness. So with that, this morning, this is how I would like to leave you on today's edition of the program, Roadway to Health. Many thanks to our guests, Dr. Douglas, Mr. Bondo, Dr. Jia, for sharing such valuable insights this morning. We have been your host, Angeline Noah, and
Melvin Stewart.
Charles Adin has been here, A.B. Salif, and George, they have all been here taking us live. Until next Tuesday, have a good day.